My name is Christian Mill. In the following small video, we would like to show you our synoptic treatment concept. The synoptic treatment concept means we stage the treatment step by step until we place the final restorations. So we start with emergencies, then clean out root canal treatments, retreat root canal treatments, extract teeth, fillings, and so on until all your teeth are healthy. That means don't have decay, don't have any gum disease, have no volume deficiencies, nor any other problems, and then we can produce the restoration at the very end. Our aim is that we can make treatment predictable and reliable. So thank you very much for your time, and we hope that you enjoy the video.
The synoptical treatment concept is a structured treatment concept. That means you have a sequence of treatment steps which guide you through a case and ensures that you have a high aesthetic, functional and successful outcome. Let's have a look at the following case. As we can see, the lip and the smile pictures show that there is something wrong with the dentition of this patient. It's a female patient with high demands on aesthetics, so we have to ensure that our outcome will succeed in this manner. To ensure that our restoration will last for the next 15 up to 20 years, it is important to classify the present teeth in different classes. First, we identify those teeth which have to be extracted in any way because they are very severely damaged. They will get a red mark. In the next step, we will identify those teeth which are damaged but which can be preserved by several dental treatment options like, for example, endodontical treatment or periodontical treatment, or even conservative dental treatment options. They get a yellow mark. The third class of teeth are those with a very good prognosis, here with a green mark. Those teeth are without any kind of damage or just with very slight damages like small decays or something. After applying those kind of traffic light identification system, we start with the first treatment step. And that means that those teeth which are identified as desperate teeth in the first step will be extracted. The left picture shows the situation immediately after extraction. On the right side, we can see the same situation 5 weeks after the extraction. So it is very important to provide a very good temporary restoration immediately after extraction to the patient, because this is the first idea we have about the target definite restoration, and the patient looks socially acceptable again. After a healing period of about 8 up to 10 weeks, we will have another X-ray image, and now we have the possibility to check the bone and do our plans with regard to the demands of the patient, if we need implants, how many implants, where is the position of the implants, do we need a bone grafting or not. In this case, in both jaws, bone grafting was necessary, so we do a sinus floor elevation on both sides, and we do bone grafting in the lower jaw as well by having 2 bone blocks on both sides. And after a healing period of about 3 months, we can have the implantology. So as we can see, 6 implants are placed in the upper jaw, and 3 additional implants were placed in the lower jaw. During the healing time periods, the patient wears his temporary prosthesis, so he's able to check if the aesthetic and also the function of the new desired teeth are working well. In the next step, we can start by doing the definite prosthesis, which is tooth supported. So we replace the first incisors in the lower jaw by all ceramic cantilever bridges, which are bonded to the neighboring teeth. And in the lower jaw, it's visible that we replace missing tooth substance with metal ceramic crowns in the posterior region. And after uncovering of the implants, we can go on and have the implant-supported prosthesis as well. So these are also 2 metal ceramic crowns on the right side and 1 metal ceramic crown on the left side. With regard to the upper jaw, we decided to provide a combined fixed and removable prosthesis to the patient because we had a severe history of periodontitis. We have a massive loss of bone and soft tissue in a vertical dimension. That's why we have to replace the gum as well and the teeth. So if we want to have a very aesthetic outcome, then it is only possible to provide artificial gum in combination with a removable prosthesis. But this kind of double crown retained prosthesis behaves like a fixed full arch bridge, but with the advantage for the patient to get it out for cleaning and have a very sufficient cleaning of the implants and the denture then. The last picture shows us that we have a very high aesthetic outcome, so thank you very much for your kind attention.